Children are not simply small adults. You know, it sounds almost too obvious, right? But in the medical world, this one profound thought is the absolute foundation of literally everything we know about pediatric health. Welcome in. If you're joining me today, you're probably someone who loves to just cut through the noise and get straight to the facts. Today, we're unpacking a massive, highly detailed blueprint of pediatric diseases, child growth, and comprehensive care.
I am so thrilled to guide you through this explainer. We're going to take an absolute mountain of medical data and international guidelines and distill it all down into a clear, easy-to-follow journey. We're looking at exactly how children's bodies, their minds, and their immune systems are constantly developing and why that demands incredibly specialized medical care.
Okay, so here's our roadmap for today. First, not just small adults. Then we'll hit common childhood illnesses, followed by diagnosis and comprehensive care, and finally, prevention and global outlook. Let's get right into it.
Not just small adults. Human development happens at just sheer velocity. Think about the timeline from birth to the teenage years. Right at birth, healthcare providers are meticulously tracking physical growth, weight, length, head circumference, alongside gross motor skills. By 12 months, that focus expands to fine motor skills and those all-important first words. Fast forward to age 5, and cognitive and social development really takes center stage. And then by 13, we're navigating puberty and some incredibly complex emotional development. So the way a disease presents itself in a 1-year-old is going to look completely different than in a 13-year-old. Why? Because their baseline anatomy and their developing brains are just in an entirely different stages.
And this right here is exactly why tracking those milestones can literally be a matter of life and death. We're always looking for normal growth, those steady upward curves on standardized charts. But when a child's physical growth suddenly drops off that expected curve into what we call failure to thrive, well, that's one of the earliest, most critical diagnostic red flags we have. It tells us that something, whether it's an underlying genetic issue, maybe a gastrointestinal disorder, or a nutritional deficiency, something is actively interrupting their development.
Moving on to Section 2, Common Childhood Illnesses.
When we classify pediatric diseases, every single category demands a vastly different, highly specialized approach. Take respiratory illnesses, things like asthma, pneumonia, or croup. A child has a physically smaller airway, so issues there can escalate incredibly fast. Then you have neurological conditions like cerebral palsy and epilepsy, which directly impact those developmental timelines we were just talking about. Throw in endocrine disorders like type 1 diabetes and genetic conditions like Down syndrome and Turner syndrome, and you can see how each and every one of these requires totally targeted, specialized care.
So, how do we actually spot the danger? If you're a caregiver, a medical student, or just a concerned parent, these are your absolute red flags. We're talking persistent fever, difficulty breathing, cyanosis, which, by the way, is a bluish tint to the skin that indicates a massive lack of oxygen, severe dehydration, lethargy, persistent vomiting, and seizures. If you see any one of these, it means the child's developing system is officially overwhelmed.
Let's see how this builds into everyday medical decisions. One of the absolute most common challenges in pediatrics is just distinguishing between viral and bacterial infections. I mean, it sounds super basic, right? But this distinction completely alters the treatment pathway. Giving antibiotics for a viral infection, like the common cold or hand, foot, and mouth disease, it won't help at all, and it can actually cause harm. Whereas correctly identifying a bacterial infection, that's absolutely essential for getting them targeted, effective treatment.
Which brings us to Section 3, Diagnosis and Comprehensive Care.
Let's ground some of these really dense medical protocols in a real-world clinical scenario. Picture a school-aged child who's just been newly diagnosed with type 1 diabetes. Step 1 is the initial diagnosis, right? Running the blood glucose labs, recognizing the symptoms. But step 2 is where the heavy lifting really starts, implementing insulin therapy and completely restructuring that child's nutrition. And step 3, well, that's where the multidisciplinary magic happens. We're bringing in endocrinologists, dietitians, behavioral therapists, and doing whole family education, because we aren't just treating a pancreas here, we are wrapping comprehensive, ongoing care around a growing child to make sure they can really thrive.
I want to just pause right here for a second and ask a question straight out of the frequently asked questions in our medical source material. When should parents seek emergency care? It is, without a doubt, the single most common question pediatricians get.
Well, here's the answer. These are the severe pediatric emergencies that demand immediate, life-saving intervention. Sepsis, meningitis, status epilepticus, which is a prolonged seizure, anaphylaxis from severe allergies, diabetic ketoacidosis, and shock. When those warning signs we talked about earlier suddenly escalate into these conditions, a child's prognosis depends entirely on exactly how fast emergency medical protocols are activated. Literally every second counts.
But what happens when the condition isn't just a temporary emergency, but a lifelong diagnosis? Consider the clinical pathway for a child with cerebral palsy. Step 1 is early intervention. We have to catch those developmental delays as early as humanly possible. Step 2 brings in neurodevelopmental therapy and physiotherapy to actually help train the child's developing brain and their muscles. Then, Step 3 introduces assistive devices and, most importantly, family-centered rehabilitation. You see, true pediatric care isn't just handing out a prescription. It's integrating occupational therapists, speech, language pathologists, and the entire family unit into a long-term strategy for school reintegration and, ultimately, an amazing quality of life.
All right, final section, Section 4, Prevention and Global Outlook.
The gold standard evidence-based prevention guidelines from massive organizations like the World Health Organization, the American Academy of Pediatrics, and the CDC are crystal clear. These simple, proactive measures are the absolute bedrock of child survival. We're talking about routine immunization schedules to build up herd immunity, exclusive breastfeeding and proper nutrition to prevent protein-energy malnutrition, access to safe drinking water, basic injury and road safety, and, increasingly, mental health promotion. Guys, these aren't just polite recommendations. They act as a literal shield for these kids.
And that brings us to the true global impact of all this. Millions. The source material emphasizes this over and over again. Through vaccination initiatives, proper nutrition, and early diagnosis, literally millions of childhood illnesses can be prevented, treated, or effectively managed. It's an incredible testament to the evolution of pediatric medicine, moving from just basic child survival improvements all the way up to modern precision medicine.
So, I want to leave you with one final, provocative thought. The guidelines tell us that investing in children's health today actively builds a healthier future for the entire world tomorrow. So, as we come to understand just how uniquely vulnerable and remarkably resilient these developing minds and bodies actually are, what steps will we take to protect them? The blueprint is already there. From the CDC to the WHO, it's really up to us to learn it, apply it, and advocate for it. Thank you so much for joining me on this explainer, and remember, keep asking the right questions.